So sorry, how I have some comments
Okay.
before you start sharing, but you can start sharing, it's okay. Es gribēju pateikt visiem, ka es esmu ielikusi kopējā čatā linku uz jautājumiem, droši rakstiet, aizpildiet, un tad prezentācijas beigās Gregoire komentēs viņus. So I said that I put in chat link with questions. So after presentation, Gregoire, you should say some words. Thank you.
Okay, Ines. Thank you. Yeah, no problem. So, do you see the screen?
Yes.
Yes. It's a little bit more powerful with a lot of colors, just to make sure that we keep everyone awake. Again, we'll speak about hand hygiene. So the context, the importance of hand hygiene, HH state for hand hygiene, the basic rules, cleaning of hands, what is a good choice of when we are speaking about soap, hand disinfection, the same, what are the good choice. One question which is coming quite often, the percentage of alcohol. What shall we know? What should we know about it? After a question about shall we choose hydroalcoholic solution or gel, or shall we go for antiseptic soap? And the last point is how to increase compliance, because this is what we want. We want to make sure people are doing hands disinfection. So importance to we'll see that the senior and regular training will definitely help, and a proper setting also easy access will definitely be a big plus. Thousands of people are dying every day around the world from infection acquired when they receive care. So this is unfortunately a fact. It's here, so it's definitely huge problems. We think that it's approximately 1.4 million cases of nosocomial infection, but probably it's more because not all countries are giving data. And the healthcare worker, sometimes are unfortunately spreading this infection patient to patient. So in order to avoid all these things, we need to reinforce the needs of hand hygiene. This is definitely a big statement. We say that it's easier to catch nosocomial infection in the hospital than losing your luggage when you do a business trip or trip to somewhere, and you check your luggage in the plane. So it's something to keep in mind. So it's a major risk. We know it. More than 60% of nosocomial infection are transmitted by hands. Is it new? Is it something old? It's something which is major issue, as we said already, but this is not new. And Dr. Ignaz Semmelweis, that you see here on pictures, demonstrated already. He demonstrated not 2 days ago, but he demonstrated in 1847. He made some observance in the hospital in Vienna, and he saw that in the first obstetric clinic where there was this Professor Klein. So it was mainly hospital director, doctors, and medical students. And he was comparing the other obstetric clinic, the one from Professor Barch. And there was something interesting. There was less mortality in Barch comparing to the clinic of Klein. So it was something interesting for him. So he started to make some investigation, started to look and to see what people are doing. And he realized that people are using some chlorinated lime First of all, the first goal of this chlorinated lime was to remove the smell of dead body. But people were using it also to, to disinfect their hands. And from the moment they started to introduce this procedure, it reduced definitely the level of infection. So 1847, one gentleman discovered the need of hand hygiene, and today we are 29 of May 2026, and we are still talking about it, saying that it's a major issue and we need to do it. So we all can bring our steps. We all can help by saying, by using disinfectant for hands to reduce infection. So it's very important. Just to remind you a little bit of skin, of anatomy. So you get the skin is, I would say, the skin flora is divided in two groups. You get the resident flora, which is able to live and to survive on your skin, the one that we know, and you get the transient flora, so the one who temporarily colonize the upper layer of the skin. And the soil is getting on this one, on the transient flora. There is three general techniques for hand hygiene that we all know. There is a regular hand washing, there is a hygienic hand treatment, and there is a surgical hand treatment. So behind those words, what do we see? So the regular hand washing, so the social level with regular soap, will be a removal of soil and the transient flora, which contaminate the skin of the skin. Basically your hands are dirty, visibly dirty. You will use the soap and you will remove the soil. So this is the regular cleaning. Most of the time we do this one with bar soap or with liquid soap, but we'll see after the liquid soap is always a better choice. Then you get the hygienic hand treatment. Hygienic hand treatment, what is behind? So we will remove the transient flora definitely. And the high level, if we can say something like this, would be the surgical hand disinfection, destruction and removal of the transient flora and reduction of number of the resident flora. So you get your hands not sterile, but you want to get to the level of being extremely clean. Here, what you see the soap, you see the foam. So everyone is thinking, these people is cleaning her hands or cleaning his hands, doesn't matter. But what shall we use as a soap to clean hands? Shall we use the bar soap, Shall we use the liquid soap? You have to think from perspective where I'm working, where I'm staying. If you're at home, definitely the bar soap will be something good because you are not cleaning your hands 15 or 20 times a day, except if you have some issues. But most of the time you will use 4, 5, 6 times per day. In hospital, you are cleaning your hands much more. So it's important to use a liquid soap. Why? Because we know the bar soap, for example, are coming from the saponification. So their pH is quite alkaline and they are quite strong. So if you start to wash your hands 10 times per day with bar soap, you will definitely have issue with the skin of your hands. Your hands will become extremely rough, and it won't be pleasant. So important to use liquid soap. Liquid soap with moisturizing agent and protective agent for the skin side. The advantage also of low viscosity will be that you can use it in dispensers, so you are not clogging them. Advantage of liquid soap with moisturizing agent and protective agent, it's you can use frequently. You can use it quite often without any problems. Without fragrance, without perfume, without color is important because you reduce the risk of allergy. Most of the allergy are related to perfume, fragrance, or coloring agents. So better to avoid it. Better to avoid quaternary ammonia also inside. The quaternary ammonia inside is also quite quite aggressive sometimes on hands. We use quaternary ammonia everywhere for surfaces, for instrument, for example. So we might develop some allergy at some point if you get also quaternary ammonia in your hand disinfectant. And also there was some study showing that quaternary ammonia in soap can as a consequences of using it could create some allergy and some eczema. The pH should be the pH of the skin, so between 5 to 5.5. And also you should request, you should ask that the product you are using has aerobio contamination. So it means there is no risk that your soap is becoming contaminated, and then you think you are washing your hands with soap, and you start to put some bacteria, some microorganism on your hands, and you start to spray it everywhere in the different surfaces. So make sure that you get a proper study for that, and request dermatological test. Request it from your supplier. Ask him, can you prove me that the product has been tested? So there is no risk of allergy and reaction. So this is extremely important. Liquid soap with cosmetic formulation in order to be able to use it quite often. This is for the cleaning. For the soap, what type of soap? Now here you can see we watch it. This person is doing a hand disinfection. There's two techniques, two methods. The first one will be the hygienic hand washing. In this case, we'll use antiseptic soap. So antiseptic soap can be based on chlorhexidine, can be based on the iodine, can be based on the, unfortunately, sometimes quat. And there is a hygienic hand rubbing. This case will be a hydroalcoholic solution or gel, doesn't matter. The current trend, we see it that it's the shift is from antiseptic soap to hydroalcoholic solution. Why? It's very simple. It's very simple. If you use antiseptic soap, first of all, you need to go to a sink. So you need to go to a place to do it. You will need to dry your hands. You will use water to rinse it. The skin tolerance at some point will be, it's not, I would say, the best. And the efficacy, you won't have the full spectrum of activity. The fungicidal activity and some bacteria, sometimes not the best with antiseptic soap. And rubbing, very fast, 30 seconds. You don't need to rinse because it's alcohol-based. You don't need to dry. You don't need a sink, so you can stay in the room. Skin tolerance are quite good, and the efficacy is quite large. So more or less, it's easier and more realistic to perform hand disinfection between patients with hydroalcoholic solution, because no need to go to sink, as we said, no waste of time, no rinsing, no drying, and good greater efficacy in terms of microbial activity. Okay, hydroalcoholic solution. So, which concentration of alcohol shall we ask? The CDC, so the Americans, is setting is saying between 60 to 95. Lancet, which is the French one, say at least 65%. WHO is saying 80%, 80% for local production. I got the chance to go to Africa a few weeks ago, and we had this conversation with the Ministry of Health, and they were telling me, yes, it's important to have 80%. I say, yes, it's important to have 80% if you are not capable to get in your hospital supply from normal products. Doesn't matter the brand, but product from, let's say, from Europe. If you are not able to get it, if the access to your hospital is too long, then you can produce your own alcohol based on the WHO formula, which requests 80%. But then the product is with hydrogen peroxide inside. It's not long-term stable, so you have to make a decision. So sometimes people are making the mistake thinking the WHO is asking 80% in general. No, they ask 80% for the local production, especially in a third country. Okay, now we know where to what to look for concentration, but shall we go for isopropanol? Shall we go for ethanol? There was this big discussion. I mean, still a few months ago, about the possible classification of ethanol as carcinogenic, but they made the mistake that the ethanol is not the way you would use the ethanol for hands are different from the one you use it for vodka, for example, so you don't drink it. But just keep in mind this. Ethanol is a natural origin. IPA is fossil-based origin. So when you see today, when you go and fill your tank of car and you see the level of price of gas, you can figure out that the IPA is going also very high. Also in terms of risk sentences, there is more risk with isopropanol. So the exposure time is also quite low. So it's, I wouldn't say toxic, but it has some toxicity point that should be taken into account. And the price of the ingredient, we just speak about it, subject to petrol crisis, and I think today we are in such a case. So the percentage of alcohol. I mean, sometimes we say, shall we put more? If more percentage of alcohol, better for hand disinfection. So higher concentration of alcohol is not automatically better for hands. Most of the alcohol-based hand sanitizer are effective about 60 to 80% alcohol. The sweet point is 70%, definitely. Why not using 90 or 100% of alcohol? So pure or very high concentration of alcohol actually work worst for killing microbes of skin. The reason is you need some water. You need a little bit of water to help denaturate the proteins in the bacteria and viruses, and to be more effective. The other point is, if you are with high concentration of alcohol, you will evaporate very fast, and then you will reduce the contact time. Then you will need to add much more. So it's not so easy. So while 70% is working the best for hand disinfection, because you have enough alcohol to disrupt membrane and protein, so you get also the water. You get enough water to slow the evaporation and then to improve the penetration of the alcohol, and you get a longer contact time on the skin, and consequently a better compliance. So this is something to really keep in mind. Gel or solution? So gel or liquid? There's two big schools, the German school and the French school. The French school is more the gel. My colleagues from Germany are more on liquid. So it's more for traditional. So liquid solution gets, in my opinion, it get wasted as it's not possible to keep it to keep the dose in the hollow of your hands. So consequently, you will put a lot of product on the surface and not on your hands. So gel are more easy to collect on your hands. The product consequently is not wasted. It's important to request thixotropic effect. So the thixotropic effect will definitely, when the gel will get into contact with your hands, it will get into a liquid, not fully liquid, but some liquids, and then it will be easier to display. So that have better for that you will have a better absorption and coverage. You have to choose the right formula for your skin. You know, it's always the same because sometimes you hear people saying, yeah, but you know, your product is very aggressive to my hands, I make allergy, and okay, maybe, but maybe there is a mistake in the use of alcohol rub. But definitely, if you don't use them correctly, you will get roughness, itchiness, sorry, dermatitis, sometimes bleeding on your hands. So it's very important to use it correctly. But also in the formulation, you should look and request that glycerin should be inside. You get some skin softening. Again, no fragrance, no color to avoid allergy, no quaternary ammonia, and request. Don't be shy. Ask us, please. I want to see the dermatological test. It's quite important. Marina? Apa. The five moments. The 5 moments, it's a moment when you should do the hand hygiene. You know, it's before touching the patient, before clean aseptics, after body exposure, after touching a patient, and after touching the environment of the patient. So all those moments are quite important. So can you imagine to do those 5 moments with antiseptic soap? No way. You will have to run every time to the sink. The advantage of gel or liquid hydroalcoholic solution will be you can do it on spot, and you will be definitely protecting yourself and the patient quite fast. The common mistake. We all know it, but I think sometimes it's good to remind it to all of us. So first of all, no jewelry on hands. Here you can see few rings. Put it on the Petri dish, and you see growth of I don't know what is it, some bacteria or some yeast, but definitely they are not clean. So no rings, no wedding rings, no bracelet, no watches. Short and round fingernails, definitely. No nails varnish, no artificial nails. They are just awful. And of course, the short sleeve. The short, round, clean nails, we see it, no rings. So we should also get the product from dosing system with elbow control. It's also it will also definitely help. Gel should be rubbed into dry hands only. Sometimes you see people with wet hands and they put the gel on it. No, it won't work. It's not going to work. You need to make sure your hands are dry, and then you apply the gel or the solution. Also, when you start to do the different steps of hand disinfection, you should go till the end and not put the gloves on it when still your hands are a little bit with hydroalcoholic solution, because this is a way you will develop definitely some some reaction. And again, use a product with a restoring and moisturizing and softening agent. We have seen during the COVID that there was a need of alcohol-based product, and some production were actually not the best. But we could, I guess, most of us we were using sometimes product which were not well made, not made as a cosmetic, and there was we had to pay the price with our skin. Another common mistake is the gloves. We should not make gloves disinfection. Gloves are single-use items. Alcohol or disinfectant will damage the gloves material, the latex, the nitrile, or the vinyl, making them porous. If you make them porous, then you will start to risk a contamination, because once contaminated, gloves can spread microorganisms on all touch surfaces. So what shall we do? What shall we do? We should change gloves between patients. We should change gloves between different tasks on the same patient. If a contamination occur, I mean, you are touching the patient with your gloves, you get some exposure to blood. Straight away, you change your gloves. You don't keep the gloves with this contamination to continue the care. Perform hand hygiene before and after the gloves use till the end, and never reuse or clean gloves as a substitute for changing them. It will be a very bad idea. The protocol, when you do the different steps, there is this famous 7 steps of disinfection of hands. Most of the times we forget the thumb and the fingertips. And these fingertips, we are using it to touch everything, and this is where you get the highest concentration of microorganism. So every time you do hand disinfection, think about the tips, think about your thumb also, because we most often forget about it. But for that, and to make sure we are performing correctly, it's important to continue to train. So there is some pedagogical box which exists, and you should use it. You should request also the senior employee of the hospital to train the young generation, to show them what to do, and to explain to them the interest of having hand disinfection. Put protocols a little bit everywhere on the wall to show how to do it. Also put posters to remind to people, yes, there is a risk, and you need to continue to disinfect your hands to make sure that you are not spreading the microorganism. Something interesting is the dispensers. The dispensers for hand hygiene are very important because more you put dispensers, more people will go to it and will use the hydroalcoholic solution. So don't hesitate to buy some and to install them in the hospital in order to push people to use it, because if they see it, they will go to it. If you leave it on tables, they won't think about it. So this is important. Thank you.
So, thank you about this. Inese ieslēdz kameru.
Yes. I start to share my screen.
No.
Not yet.
1, 2, 3, 4, 5, 6 questions. So at first one, wedding rings.
Yeah.
Those ones.
Yeah. Out.
Yeah, in your presentation, it's also that wedding rings
Out.
have to be taken off.
Yeah.
Yeah, it's correct.
Yeah.
From one point. I know that my small boss, I mean my wife, always is taking off and keeping it here, somewhere here.
Yeah. On the
But
necklace.
when we had an audit, it was 2015 in CSSD in Riga East. Some of my ladies, not my ladies, but some of my staff.
Okay, you do whatever you want.
Working in my department, they said that their husbands don't allow them to take off a ring.
Okay.
And I explained this to auditors, and they said, okay, then you have to establish new procedures for, yeah, for for cleaning all those surfaces under the ring. What do you think about this?
I think it's most of the time we all have difficulty to remove it. So even if you put a protocol in place, it won't be so easy to reach the place under it. But more, I think there is another point. It's the ring by itself. It's not perfectly. There is cracks on it, and I think no one is doing disinfection of the rings by itself. And okay, you can focus on the surface of your skin under the ring, but also you have to take into consideration the ring by itself. And this is maybe more difficult.
So it means that in any case, when I'm discussing with a new staff,
Yeah.
and it's married lady, I have to ask her, is she ready to take off ring? Yeah.
Yeah.
Sorry, it was a joke.
Yeah. Yes.
So nails.
Yeah.
It's the next one. As I know, in Germany, it's allowed some types of artificial nails to use. But in Germany, it's officially allowed. What do you think about it, or what your comments?
I think artificial nails are quite, there was, I think, a study not long ago with artificial nails that they put on Petri dish, and it was completely contaminated. Also, you get the same problems. There is some cracks on it, so you always get the problem with contamination on it, and you cannot get rid of it. So there is a problem somewhere, because hospitals are saying we cannot get people to work for us. It's difficult to find teams. I mean, to find new employee. And when the new employee are coming in the hospital and they start to hear, okay, ladies, I'm sorry, but rings off, no artificial nails. You are not encouraging people to come in this field, So I think this is why Germany tried to find a balance, but still, I think it's. I wouldn't think in the operating theater you see people with nails,
Yeah.
with artificial nails. Yeah.
Okay, I agree with you.
Thank you.
Next one, dental offices.
Uh-huh.
Okay. Now, in your presentation, after each patient, change gloves.
Yeah.
It's quite understandable.
Yeah.
But in dental practice,
Yeah.
when dentist is touching our mouth cavity, is it necessary to change gloves after touching mouth cavity? or he can work with the same gloves during the whole procedure.
No, it's good to change it because there is a risk that you got the infection on the gloves, and after you will start to
Yes.
spread it everywhere.
Yes.
Okay.
Yeah, because he's touching lamp
Exactly.
handle. Yeah.
Exactly. Yeah.
Yes. Thank you. So it's not all. Soap is perfumes.
Mm-hmm.
It was 2015 when audit from Denmark remarks that soap with perfume in CSDs is not allowed, or not allowed, or not recommended. What you can comment about this? Soap or disinfection agent with perfume?
And you should avoid it. You should avoid it. You should avoid the perfume because you want people to use it. And if you use one of the risk with the perfume, because it's artificial perfume, it's not a real perfume, you will bring more chemicals inside, and more or less you can develop some allergy to some people. And if the people start to develop allergy, they won't use the soap or they won't use the gel anymore because say, okay, this product is very I mean my skin is too sensitive and I don't want to use it. So this is why we always say that perfume and coloring agent, because they are not natural, they are chemical based, so you are just bringing more risk of bringing allergy for the user.
Okay, thank you. Yeah, thank you about this explanation. And sorry, next one. After you are taking off the gloves, what you recommend? Washing and disinfection, or only disinfection, or only washing? Hands, I mean.
It's where you are, first of all. This is the first question. Are
It
you
depends.
Yeah, if you are in the operating theater and you are removing gloves, it means maybe you are the surgeon, so you have to go back and to do the full procedure. If you are just in a ward doing cares and you remove your hands and your hands are visually clean and not wet, because sometimes you could be wet also because you are sweating, then you can make a hand disinfection. The best is to do hand disinfection with hydroalcoholic solution.
Okay, thank you. And one more in your presentation, worst case, disinfection with alcohol 80%.
Yeah.
Yeah, it's a worst case, but the question is, when we are disinfecting with alcohol 80%, it's coagulating proteins.
It what? Sorry?
Coagulating proteins, fixing proteins on the surface.
No. The thing is, if you the 80% is more connected to WHO and to safety, because they want in the third country when they cannot have access to normal product like everywhere in Europe, so they start to make their own formula. They use 80% in order to have some safety, because maybe there will be a reduction of concentration of alcohol at some point. So they want to start at a higher level. We all know that formulation between 60 to 80% is correct. I mean, it's good. If you start to go from 90 to between 90 to 100%, then this is more will limit, won't be a good disinfection, won't have good disinfection properties. because it won't have enough water to denaturate the proteins. You need water to hydrate the proteins in order to work properly on it.
Yeah, okay, thank you. And
Yeah.
now I'm giving word to Ines.